Welcome to this Medical Appraisal Skills video workshop. This is one of a series of short films intended to explore some of the challenges presented by medical appraisal conversations, and to encourage you to consider helpful behaviours, strategies and mindsets for these important meetings. The purpose of this scene is to explore how we can encourage doctors to reflect on their practice during an appraisal conversation. Let's join our doctors mid-appraisal.
I was interested to hear more about the Care Navigator pilot, which I know you've just completed. How did that go?
It was really successful, yeah.
And what makes you say that?
Well, we had really good feedback from the patients and from the navigators. I think they really appreciated having supervision from a variety of professionals, actually. And the practices involved, they worked really well together through the navigators. What else worked? We got some really good feedback, some best practice from it.
Good.
And we also managed to capture some approaches and strategies for those patients with long-term conditions, how to maintain their independence. So that was really successful.
Yeah. So what did you get out of it yourself?
I really enjoyed the patient groups. I really valued their input, and I think we could work with them again on some more developments. There were some niggles, actually. They were quite challenging with me, and I think that was good because it challenged my assumptions about patients not really wanting to be involved in their own care. So that was good. And what else? Oh yes, I was amazed actually at how powerful the supportive team supervision could be at empowering, at validating the navigators, and they themselves actually grew from strength to strength and made their roles even more effective.
Sounds like some really positive things.
So, absolutely.
So what next? How are you going to take this forward?
That is a really good question. I don't really know, if I'm honest. I've been focusing quite a lot on another project on governance that I think is really important for our practice right now.
I'm conscious that this doctor's enthusiasm for her work might mean she's struggling to embed the learning from her projects. What can I say to test this out?
What would you do at this point? Discuss this, and when you're ready, we'll find out what our appraiser decides to do.
Obviously, governance is very important. And how are you going to harness the learning from the Care Navigator pilots? It sounds like you've got some really good gains for your patients and the teams. I'm just worried there's a risk you might lose that.
That's a good point, actually. I suppose the practices involved will just have to make it one of their priorities.
Okay, but, all right. You led the teams,
Yep.
You've got them engaged. Who could take them on if you decided you wanted to get your bit between the teeth and get on with another project?
Okay, you are right. I am always quite keen to move on to the next thing. You read me very well there. I suppose if I don't do something, no one else will.
So?
Notice how it's not always important to find an insightful question. Often the simplest questions or prompts, so, what else? Tell me more, are the most powerful.
So?
So I will get the team together and I will talk to them about how they want me to lead the project forward.
Okay. Well, I mean, I think that the navigators, supervisors and teams will be more than happy to support you and give you valuable support in this.
Oh, you're absolutely right. Yeah, they've been great so far. So, yeah.
Good. Okay. Perhaps that should be in your PDP plan. Although, actually, I think we'll do that later. There's something else I'd like to talk to you about. Okay. It's one of your SEAs, a late diagnosis cancer patient, a man of 40 with bowel cancer. And I was not quite sure what your reflections were on this case.
Yeah, a really difficult and upsetting case, actually. An individual who was well known to the practice, actually a good friend of our senior partner, unusual blood test results, assumed to be regular but not excessive alcohol intake. 6 months later was under investigation following presentation of severe abdominal pain and found to have liver secondaries from a colon primary. The secondary is too large for resection, so he's now undergoing chemotherapy and prognosis is poor.
And what was your part in this patient's care?
Well, I wasn't the only doctor to interact with him, and one of my colleagues also looked at the blood test results, but fundamentally he is my patient, and I feel pretty awful about it, actually. It wasn't the best outcome for the patient.
So what might you do differently?
Well, earlier diagnosis would probably have meant a more favourable prognosis. I haven't talked to the patient about that yet. I find it very difficult, actually. I feel so ashamed that I didn't get it right. We've also looked at the communication between us as doctors regarding the blood test results. We know that was not good. So we've begun preliminary discussions between ourselves about that area of the case as well.
So what about the patient?
Notice this is a challenge, but delivered as a probing question rather than a confrontational statement.
So what about the patient? What does he need from you?
I think he needs me to be honest with him, and I think he needs an apology. Actually, I think that's the least I can do. Thank you. I found this so difficult to even think about, let alone think through and acknowledge what I need to do for the patient. So yes, I will contact the patient and I will talk to him about this case and be very honest with him about it.
Good, and that fulfills the duty of candour, the legal requirement for us to be honest with patients when we make these mistakes.
Indeed. Yeah.
Okay. Well done. Thank you for your reflections. One thing I've noticed, your reflections during this conversation have been very good, very insightful. So what I would encourage you to do in future is reflect, capture that reflection, so that you are then capable of accessing it in situations other than the appraisal conversation, if that makes sense, so that you embed it in your own practice, and it will become second nature after a while, and will certainly make you a better doctor. So that was very good. I hope you found that useful.
Oh, absolutely. Thank you.
Good, thank you.
What did you notice about the appraiser's approach to this conversation? What worked? What might you have wanted to see done differently, less, or more of? Consider in particular the balance of support versus challenge. It's in the quadrant of high support and high challenge where the richest conversations are likely to take place. Finally, based on your discussions with your colleagues and what you've learned through watching this film, what are some helpful ground rules or tips for these conversations?